Pak Panji monitor itu hostnya bisa dipindahkan ke Departemen Fisik yang Mas Faisal.
Ini sudah saya, Pak.
Oh, ya wes.
Pakai
Oke,
Zoom-nya
oke.
Pak Panji, Pak.
Oh iya, tadi kan gambarnya Pak Panji kan. Oke, ya wes. Oke.
Jangan lupa direkam ya Mas Faiz.
Cek, 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 cek. Itu mati itu. Cek, cek. Halo, halo,
Halo.
halo. Berarti mic-nya ini perlu dipisahin di sini enggak?
Kayaknya malah ngaruh Pak. Soalnya nanti harusnya ini bisa langsung ke dari PC yang ini.
Iya, dari PC yang ini. Cek, cek. Halo, cek, halo. Ada suaranya enggak di situ? Di layar.
Wis ento.
Bunyi. Kita nggak punya, berarti pakai yang itu aja. Paling. Mic-nya yang sini biasa nggak gitu. Coba kamu cek. Hmm. Cek, halo. Cek, halo. Cek, halo, halo, halo.
Hey, hi, hi. Sorry for the late joining.
Oke, thank you, Mr. Soma.
Okay, okay. Can you see my slides?
Yes,
You can see my slides, huh?
Masih
yes.
record mulai apa ya?
We see your slide.
Si mulai record mau siapa ya? Pak Zainal.
Okay.
Apa fokus? Soal
Let,
YouTube ya.
uh-huh. Let me try again.
Kita
Boleh?
YouTube ya. Enak. Enak YouTube ini nih. Langsung tadi video. Nggak perlu render. Si mulai record mau siapa ya? Pak Zainal.
Can you see my slides now?
Yes, yes, we see your
Okay.
slide.
Okay. And you can hear
Okay,
me, right?
Mr. Soma, we
Yes.
will start from moderator and MC.
Okay.
Please start your MC.
Okay.
Silakan.
Okay. Shall I start now?
Yes. Okay.
Okay. All right. Okay. Boleh ya? All right. Okay. So let me know if you cannot hear me correctly or clearly. Otherwise, I will proceed with the presentation. Okay. Thank you very much for the opportunity
Sorry,
to.
Mr. Soma.
Sorry.
Sorry,
Yes.
Mr. Soma.
Yes.
Yes, my student prepare for starts of a ceremonial of this online seminar.
Okay. Okay. Can no problem. I'll wait for that.
Okay. Thank you.
Welcome.
Good morning.
Good morning, everyone.
Assalamualaikum
Good morning.
warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
On behalf of the Department of Physics, Diponegoro University, I would like to warmly welcome you to this public lecture. We are truly delighted to have all of you joining us here on Zoom.
Before we begin, let us express our appreciation to Prof. Harry, Head of the Department of Physics, Diponegoro University, our distinguished speaker, Mr. Soma Somanesan, from the Department of Nuclear Medicine and Molecular Imaging, Singapore, and our moderator, Kenny Hadinata, SSE, from the Department of Physics, Diponegoro University. Now, we would like to kindly invite Prof. Harry as the head of the Department of Physics, Diponegoro University, to deliver his welcoming remarks. Prof. Harry, the screen is yours.
Okay. Okay. The voice is clear. My voice.
Yes.
Okay. Thank you. For Master of Ceremony. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, all participants. On behalf of the organizing committee, I would like to warmly welcome you all today in general lecture with the theme reconciliation of radiation safety and aseptic procedure in radiopharmaceutical synthesis based on good manufacturing. Our Honorable Mr. Soma Somansen from Department of Nuclear Medicine and Molecular Imaging, Singapore, as today's speakers. Thank you very much, Mr. Soma, for your kind willingness to share your knowledge and expertise with us. We are truly delighted to have you here. I would also like to introduce our committee chair, Mr. Zainal Arifin, Master of Science, who has worked tirelessly together with the team to make this event possible. We sincerely hope that this lecture will not only broaden our understanding of the subject, but also open doors for future collaboration. It is our wish that today engagement can be the beginning of a stronger partnership and more intensive cooperation in the future. Once again, welcome, and we wish you fruitful and inspiring session ahead. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Eh, Halo?
Hello.
Thank you very much, Prof. Harry, for the
Ya,
warm and inspiring remarks.
oke.
Ladies and gentlemen, today's lecture brings us to very important subject, reconciliation
of radiation safety and aseptic procedure in radiopharmaceutical synthesis based on good manufacturing practice. We are honored to welcome Mr. Soma Somanisan, who has extensive expertise in nuclear medicine and molecular imaging. His insights will surely provide us with valuable knowledge and inspiration.
To guide us through today's session, I'm pleased to hand over the program to our moderator, Kenny Hadinata SSE from the Department of Physics, Diponegoro University.
Okay, thank you very much for the Master of Ceremony. Okay, so good morning, ladies and gentlemen, and all the fellow students. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Let us express our gratitude to God Almighty for His blessing, which allow us to gather virtually in this bright morning for the public lecture organized by Department of Physics, Diponegoro University. Today, public lecture will be discussed very relevant and important topics: reconciliation of radiation safety and aseptic procedure in radiopharmaceutical synthesis based on good manufacturing practice. This topic will be delved into how we can align radiation safety procedure with aseptic standard in the good synthesis radiopharmaceutical in accordance with GMP, or as we know as good manufacturing practice in principle. So let me introduce our speaker to dive deep into this material. So for our speaker today, we know this Dr. Somanesans as a senior principal medical physicist from the Department of Nuclear Medicine, Molecular Imaging in the Singapore General Hospital. As we know, as Mr. Somanesan is also do the hospital radiation safety officer as a chief in radiation response team. Also as the operation and QA manager positron trace PTE Ltd and any other else. So, Mr. Somanesan, are you in the meeting already?
Yes, I'm moderator.
Yes, okay. Mr. Somanesan is an expert from the department and the nuclear, so we are very proud that he can take the time to share his knowledge and experience with us today. Without further ado, let's invite Mr. Somanesan to begin his presentation. The time and platform are it's yours.
Okay, thank you very much, moderators, as well as Professor Harry, as well as Professor Zainal for this invitation, this kind invitation to provide this talk. As Prof. Harry has mentioned, this could be the start for future collaborations, both in terms of education, exchange, as well as perhaps even research. So thank you very much
Thank you
for
very much. Mr. Soma.
Yes, and it's my pleasure as well. I just wish to highlight that, can you see my slides in full screen? Is everything okay? If it is, okay, cool.
Yes, we can
saw
see
them.
clearly.
Yes, okay, cool. So I'm sorry, I just came back from Samarinda. I was there for a nuclear medicine conference, so I presented this slide as well. So that's why I'm using the same slides as I had presented in Samarinda during the Nuclear Medicine Society meeting. And the same topic was of interest to everybody as well. And yes, so with that, let me continue with the agenda for today. This is what I'm going to talk about. The radiopharmaceuticals are sterile injectable medicinal products. Normally, we inject very small micrograms into patients. And of course, I want to highlight the manufacture of radiopharmaceutical is subject to both regulations. One is regarding the radiation, and the other is about pharmacology. So in Indonesia, there are two two main departments that are looking after those regulations. One is Papatan, who looks after the radiation protection aspect of it, and the other is the BPOG, which is under the Ministry of Health, which looks after the pharmaceutical synthesis and pharmaceutical distribution and use as well, right? So both these regulations need to be met when we are dealing with synthesis and the use of PET radiopharmaceuticals. So I will also talk about the requirements in order to minimize the risk of microbial contamination, or more like importantly, in a crude form, we do not want to inject any bacteria into our patient, right? So that's one aspect or one of the main criteria of making good pharmaceuticals that are clear and does not contain any particulate or priogens when they inject them. And of course, secondly, very importantly, all of you are also aware that radiation safety is very important, and you also know that ALARA, that is as low as achievable radiation, is what we expect for our staff as well as of our patients as well. So the aim is to, of course, to reconcile. That means look at both these regulations and see where we can compromise, where we can make sure that we can meet both these requirements. So that's basically, in a nutshell, what I'm going to talk about today. I'm sorry about this busy slide. I will share the PDF of this talk with Dr. Zainal, who will then send it to all the students as well. Now, this I want to introduce the manufacture of PET radiopharmaceuticals. Since Indonesia, just like Singapore and other ASEAN countries, are also signatories of the PICS. If you can see in this corner here on the left, on the right-hand side top corner, you will see the PICS. This is a organization of pharmaceutical manufacture, and it's the main organization in the world which looks after how to standardize the manufacture and the distribution of medicinal products. And radiopharmaceuticals also comes under this recommendations. And because Indonesia and Singapore manufacture drugs for export to other countries, we have to comply with this PICS. So as a result, radiopharmaceuticals also need to be classified and have to comply with the PICS requirement as per the FDA of every country, including Indonesia as well. Now, the second bullet point, if you can see, the compounding of radiopharmaceuticals, as all of you would realize, in the nuclear medicine department, you would actually compound a technetium-based radiopharmaceutical together between the technetium and, for example, if you're doing a bone scan with the MDP, or if you're doing a liver scan with a sulfur colloid, or etc., right? That compounding does not come under PICS, all right? So this PICS only looks after the synthesis of PET radiopharmaceuticals as well as therapeutic radiopharmaceuticals that are used in peptide, or for that matter, PSMA treatment of some kinds of cancer. Right. So with that, we have to particular attention needs to be paid to make sure that there's no cross-contamination between the products that we synthesize. All right. And lastly, I want to highlight that the transport of radiopharmaceutical is regulated by local radiation regulations. In the case of Indonesia, you would be Papatan, who looks after the regulations of transport of radiopharmaceuticals from one city to the other. Now, I just want to recap the radiation safety considerations in handling PET radiopharmaceuticals. RPS, in short, is for radiopharmaceutical that I'm going to use in these presentations. And we are dealing with high level of activities, high radioactivities of sometimes 15 millicurie when we inject into patients. Normally it's about 5 to 10 millicuries, but maximum could be about 15 millicuries. And the PET radiopharmaceuticals have a very high energy of 511 keV, right? And we therefore need tungsten as compared to lead shields to shield these syringes and these vials, all right? And as ladies and gentlemen, you would have seen in nuclear medicine, they use lead shields for both vial shields and syringe shields for injections. That is acceptable, that it may be made of lead. But when we move to PET radiopharmaceuticals, which release 511 kilo electron volts, we need a much thicker lead. Now, ladies and gentlemen, if I may tell you to look at the table at the right-hand side, you will realize that if you see technetium, the half value layer and the 10th value layers for technetium using lead is about 0.3 and 1 mm respectively. Right? So if you just compare this value, these two values compare them with the fluorine 18 requirements, the half value layer in lead for fluorine 18 is about 4 times. If I take a quick calculation, see if you take 4 divided by 0.3, you are having something like 13 times more amount of lead compared to technetium to shield it, to ensure that you only get half of the incident radiation going through. And just imagine if you look at the 10th value layer, you need again about 15 millimeters of lead as compared to 1 mm. So ladies and gentlemen, if you look at the bottom picture, if you look at this 2 mm tungsten, this may be sufficient for technetium, but the syringe shield on this left here, if you can see my mouse, is insufficient for 511. So 511, you need a much thicker amount of tungsten, for example. And the reason why we use tungsten versus lead is because tungsten is more effective in terms of radiation protection. Of course, ladies and gentlemen, we can use gold as well, because gold is also a high atomic number material, and it is able to also attenuate very well. But next day it'll be ilang, okay? So because gold is very expensive, and we are using tungsten, all right? Not saying that tungsten is not expensive. Each of these syringe shields, like you see over here, can cost about $2,000 or something like this, because of the fact that tungsten is also an expensive element. Right now, so if you look at the left-hand picture, you can see the L shield here. That is a thick lead barrier. You can see that this whole L shield that is suitable for 511 will be about almost close to about 900 kilograms. So this is heavy because of the sheer amount of lead and lead glass that is present here. Now, ladies and gentlemen, this will be very different from the technetium L shield, which is much thinner amount of lead, again, because of this half value and 10th value layers for technetium. All right. So with that, let me go on to the next slide. Now, I'm not going to go through these details because this is something that you can read as well. And in this case, it's basically we are dealing with a manufacturer of radiopharmaceuticals, and they have to comply with the PICS requirements. That's the symbol that I talked about. And PICS stands for Pharmaceutical Inspectorate Cooperation Scheme. So all of these requirements need to be met, and that is not the focus of today's talk. As a result, I will skip this slide, but this is needed if you want to make radiopharmaceuticals, right? For that matter, any kind of pharmaceutical, whether it's radiopharmaceutical or otherwise, needs to comply with all these requirements as well. Now, the basic element of GMP is quality assurance system. QA, in short, is of a given greater importance in the manufacture of radiopharmaceuticals because we are dealing with very small volumes per production. Unlike when they are making Panadol or cough syrup, they make thousands of liters or thousands of kilograms at any one production in a pharmaceutical company. Right? Whereas in the case of radiopharmaceuticals, you may only manufacture something like 15 milliliters in one production. And this 15 milliliters, ladies and gentlemen, is cukup for the use of maybe 18 PET CT scanners or that could be equivalent to about 50 to 100 patients that can be utilized. The thing is a small volume, high concentration of FDG, for example, is needed and it can be utilized. All right. So we are dealing with small volumes once and for all. And another thing is the important consideration is we need to administer the product before testing can be complete. And some of the half-life is very short, like carbon 11 has got only 20 minutes half-life, whereas gallium 68 is 68 minutes half-life, and fluorine 18, which is a popular use in FDG, has got 110 minutes half-life. All right. So as a result, we need to quickly administer before we can finish all the quality control tests needed before we can use it on our patients. So therefore, QA is extremely important for radiopharmaceuticals. Second point is the QMS in radiopharmaceuticals is a sum total of all the QA procedures, macam like all the quality control tests that is needed, and also the in-process control, the staffing, the quality, all sorts of things needed to be complied as well. Okay, so we will look at some of these aspects of this quality management of a radiopharmaceutical pertinent to two aspects. And the one, aseptic, that means is kept clean and sterile and clear of all the virus and bacteria. And second thing is radiation safety. So that's the focus of today's talk. Now, ladies and gentlemen, the non-GMP component of a radiopharmaceutical synthesis is two things: either a nuclear reactor like what you have in Jakarta, or the cyclotron production, which you have several in several cities in Indonesia and in other countries as well. For example, last week I was in Samarinda in East Kalimantan, and they also have a cyclotron which manufactures fluorine 18, and both of these are non-GMP. That means they don't need to comply with GMP. Whereas if you look at on the right-hand side, you see that the synthesis of the pharmaceutical, the purification steps needed for the synthesis, processing the formulation and the dispensing, as well as the aseptic and final sterile, all these aspects have to be comply with GMP requirements. Okay, whereas this one, no need. And with that, let's move on to the next slide, where I'm going to talk about the manufacture of radiopharmaceutical and the requirements for the clean room facilities. So the manufacture of sterile products needs to be conducted in a Class C environment at least, and they must make sure that the particulate and pyrogen are free of the product. That means the product is made sure it is clean. It doesn't have any small particles of 0.2 micron, for example. And as well as it must not have any pyrogens, because we cannot make the patient more sick than the patient is, right? So, and they need to comply with the GMP Annex 1, which is in my reference material, which you can take a look at. It's easily downloadable as well. If you type PSCS GMP Guide Annex 1, you can get the requirements as well. The GMP has classified the cleanliness of the manufacture of sterile products between the grades of A to D. And if you look at this table at the bottom, you can see grade A here and grade D at the bottom. Now, the grade A is a higher requirement in comparison to grade D. So grade A is, for example, for 0.25 micron at rest, they have a maximum of only 3,520 particles in 1 meter cube of air. If you can look at it, it is 1 meter cube of air. Whereas for 5 micron size, you must have less than 20 particles in 1 meter cube of air that is sampled. Okay, so if you look at Class C, it goes up drastically to about times 100. If we have 352,000 particles of size 0.5 and 2,900 particles of size 5 micron in a Class C environment. Class C is where you can synthesize the product, the radiopharmaceuticals. Class A is where you can dispense the product into smaller aliquots, or from a primary vial into a secondary vial, for example, right? All these classifications are based on the ISO 14000. Okay, so with that, I want to show you a typical layout of a PET radiopharmaceutical production. If you can see on the left bottom, you can see the cyclotron that is over here on the left side. And you can see the thick wall of about 60 centimeters. Now, this picture is it's superimposed because it shows a self-shielded cyclotron. If you can see, the dotted lines are the self-shield. But in the case of many of the cyclotrons in Indonesia, they are using a unshielded cyclotron without the shields. That means you have to have a thicker vault doors and walls as well, maybe a thick of about 1.5 meters thickness. Whereas in this case, in Singapore, where everything is very small, we don't have a big room, so we put a self-shield there and encase it with a vault of about 60 centimeters of concrete. Okay, and next to it, you will see the clean room, where is adjacent to the cyclotron vault, and you see these small squares. These are the hot cells. Now, the hot cells are basically the Class C environment. In fact, the whole room of RC, which stands for radiochemistry, is considered as a Class C room. Now, to enter the Class C room, one needs to enter into the empty room where they change their baju to clean room baju, and then go walk into the clean room to do the work. And you have QC room, then you have the equipment room for the cyclotron, the control room for the cyclotron, and offices, etc. Right? So this is how a typical facility would look like. And of course, the current facilities that are being built as we speak in Jakarta and around Indonesia as well are much better than this, because they are modern facilities. This facility, which I helped to construct back in 2002, is quite primitive in compared to some of the new sites in the pharmaceutical industry in Indonesia, like Kelbe, for example, and other companies as well, which have a newer and better and larger facilities for the synthesis. This is a zoom up of the clean room that we spoke about. As you can see, it's very small. In amount of space is only about 1.5 to 2 meters thickness between the table and the clean room hot cells. Now, the hot cells are basically lead cupboards, which are also, as I mentioned earlier, Class C environment. And this is the entrance. And these two blue color boxes are the doors, and the only one door can open at any one time, because we don't want the unclassified dirty air to enter into the clean room. So the ISO class 7 or grade C air is got a size of 10,000 particles per meter cube compared to unclassified rooms, right? So next, I want to highlight the monitoring that we need to do in a clean room, all right? So it's recommended that we do the settled plates. These are settled plates which pharmacological microbiology will utilize, and generally they have a solid agar solution of either TSA or SDA, and they come in a form like this with a plastic wrapping around it. When you want to use it, you remove the plastic wrapping and you expose this. And if you expose this on the table, then you are looking at a settled plate. Or if you put it into a machine such as this is called an air sampler. What it does is this blue portion at the top, basically, it sucks in about 1 meter cube of air and throws the air onto a plate like this. This plate is actually sitting inside this air sampler, and then you can see a readout of how much particles there are in this basically the flow rate, etc., can be seen. And then after that, you have to close this settled place and send it to pharmaceutical microbiology to do assessment to see if there's any particles inside here, right? Once again, this is called an air sampler. So air sampling needs to be done, settled place needs to be done, as well as particulate counting needs to also be performed as well. Now this slide basically looks at the recommended microbiological monitoring of clean areas, right? So now we looked at particles, which are non-viable particles, but now we are looking at viable or microbial particles. Now this test cannot be completed in one day. In fact, the plates that we spoke about, that is this kind of plates and this kind of device that is used for the air sampling, needs to be compliant with this based on the grade. So for example, for grade A, in the dispensing hot cell, for example, you see this, all have to be 0. Cannot have a single growth on the plate, right? Whereas Class C, you can have a certain amount of growth, like macam 100 or 50 or 25 for the types of air sampling, settle plates and contact plates. But in the case of A, all kosong, only allowed is 0, all right? So that's a take-home message. So with that, let me move on to the next slide. Okay, so the manufacture of radiopharmaceuticals, let's now look at the radiation component, all right? Perhaps that could be the focus of today's talk as well. The environment and operator must be protected against the radiation. And as a result of what I highlighted, for fluorine-18, you need much more thicker amount of lead or much more use of a better material than lead for shielding, and that could be tungsten, all right? And the preparation of radiopharmaceuticals involves adherence to the radiation protection requirement, as what Papatan in Indonesia refers to. And in Singapore, it's called NEA, which is the equivalent arm, right? And generally, radiopharmaceuticals should be manufactured in a controlled areas as well. And all manufacturing should take place in self-contained facilities that are dedicated to radiopharmaceuticals. You can't make use of the same facilities to make other drugs or other items as well. So it's purely for radiopharmaceuticals. Okay, so once again, the idea is to prevent the cross-contamination. And these are in a contained equipment, and it should be basically only open for cleaning purposes. And the reason why it needs to be closed or contained is because you want to prevent contamination again. You see, the importance of preventing contamination is very high, both in the point of radiation contamination. At the same time, we don't want to contaminate the product with bacteria and virus as well. Okay, and of course, the access or the entry into the clean room should be a gowning area, which I showed you before, and which should be restricted to only authorized personnel who are dealing with this synthesis. It could be radiochemists or technicians, etc. Right? And hot cells, as you can see the picture over here, these are very thick lead. Of course, what you see is the stainless steel. Stainless steel, of course, can be clean on the inside and outside of this hot cell. At the same time, the stainless steel hides the 7.5 cm of lead. That means there are a huge amount of lead, and each door can be very heavy to open and close because they have got 7.5 thickness, 7.5 cm of thickness of lead inside. Okay, and that is needed to keep the 511 keV gamma rays from coming out of these hot cells. So this, for example, is a dispensing hot cell. We can see this arm over here, the gripper arm, and the lead glass for them to observe what is going on inside. At the same time, this is once again is a dispensing hot cell, right? So with that, we move on to a picture here. This is a clean room, for example. Sorry, it's not a very beautiful picture here, but important consideration is here it says it's plus 10 pascals. Right, this is a pressure. So the pressure inside the clean room should be a positive pressure compared to the next room, that is the change room, which is 0 pascals, which should be higher than the outside room. See, as you can see, from here you have let's say this 0 pascals, all right? 0 pascals, and then when you enter here is a negative pascal, negative 10 pascal pressure, atmospheric pressure. Then here is 0, and then is 10. So what I'm trying to say is that there's a gradient of pressure, with the clean room being the highest pressure and the outside room being the lowest pressure. The reason for this is you do not want unclassified air to enter into the clean room. Okay, whereas you can allow the clean air to come out through under these doors, for example, outside, but you don't allow a dirty air to come into this room. Okay, so that's basically the basic principle of operating a clean room in a pharmaceutical atmosphere. And of course, you have ducting like blue ducting and plain ducting. Basically refers to ducting, removal of the air and maintaining the pressure within these rooms as well. Okay, so with that, we want to also go on to say that inside a clean room, you cannot have ducts, for example. If you can see this picture here, this is a clean room, but you can see the HEPA filter at the ceiling. These are all clean room walls and ceiling as well, and the floor as well. But if you look at this, you can see a little recess here, and this is not acceptable. Why? Because there will be a lot of crevices and corners, and all these crevices and corners are difficult to clean, and as a result, may impede the cleanliness of this room. So a clean room, as you can see, must be straight walls like this, no protrusions, no sinks, no floor traps, no emergency shower inside such a room. All right, so this is in accordance with pharmaceutical synthesis. And you look at this area over here, you can see a small gap. Now this gap, I certainly cannot go inside this gap. And certainly I cannot clean this area in this between the wall and the ceiling and the cabinet, right? So as a result, this will fail as a clean room. Okay, this is an example of how a clean room shouldn't look like. And this is how you can see hot cells. This is, as I showed you just now, was a dispensing hot cell. This is a synthesis hot cell, and there are other synthesis hot cells as well. There are many such facilities in Jakarta and other parts of Indonesia, and some of them are being built where they actually have a very clean surroundings, such as here, there's a cove up of the floor, for example, so as to easier to clean. And also for the ceiling part is integrated together with this. So try to prevent any gaps, etc. As you would have seen, this is a dose calibrator that is connected to the dispensing of this hot cell. Now, these are two staff working in the clean room, which is a space between them is only about 2 meters. And as you can see, this is a stainless steel table, again, because it's easy to do the cleaning as well. And this is the inside of this, what the staff is looking through this dispensing hot window. And this is how inside as well. It looks also like stainless steel as well. Once again, for radiation protection, as well as to keep the product here clean as well. So next, we talk about the change room and empty room. This is designed as an airlock. As I mentioned, what is an airlock? Airlock means is a differential pressure in comparison to the clean room and the outer room as well. So generally the empty room or the change room where you change your baju and go inside the clean room has got in-between pressure between the two rooms. Meaning that the innermost room would be the clean room, which is a positive pressure. Then the airlock or empty room will have a slightly lower pressure compared to another room will be another lower pressure. So something like a cascade of pressure as well. So a clean room has a filtered air supply, and it should maintain a positive pressure, as I mentioned just now, respect to the empty room, which is also a higher pressure compared to the outside, right? So the workstation should be monitored for radioactivity contamination, just like you would measure the radioactive contamination in a hot laboratory or a procedure room where you do a bone scan injection or any other kinds of injection. You need to survey the place with a Geiger-Müller tube. And secondly, you need to do a wipe test to determine if there is a removable contamination as well, because the removable contamination is a bigger concern because you can contaminate your colleague or your staff or other workers with the radioactivity that's spilled on the table, and they unwittingly, they could bring the radioactivity into their kereta or their rumah as well. So therefore, we want to make sure that we look for this removal contamination. And if we do determine that it is contaminated, we need to do a decontamination so that the staff will not access it. So likely you would realize that both these two tests are needed to be done on a regular basis, maybe even 2 times a day, depending on the risk of a contamination or risk of a spill as well, especially in procedure room, hot laboratory, where you deal with technetium or other pharmaceutical. I wish to stop here for a while to see if you have any questions, ladies and gentlemen. You can also put your question in the chat, or you can unmute your mic and ask a question as well.
Okay, thank you, Mr. Somanesan. Maybe for the question we will put in the end of the
No
session,
problem.
so all the people can learn about your presentation first.
Boleh. Thank you, Kenny. All right. So with that, let's move on to look at the manufacture of radiopharmaceutical. Is a radioactive contamination needs to be checked prior to sanitation. So one important consideration before you go and clean the place, you need to check for contamination, because otherwise, if you allow the cleaning to be done by the cleaning staff, they may be spreading the contamination around. So therefore, we need to check for contamination before we can say, hey, okay, now you can go and do the cleaning. All right. So that's something that you need to keep that in mind. And clean room should be sanitized in accordance with the SOP that you have. For example, you may have to use more than one disinfectant. One could be alcohol to ethanol to do the cleaning. On the other is you may need to use a sporicidal chemical to do the cleaning as well. Okay, and sometimes you may need to call in the fumigation if you have uncontrolled growth. And these are two pictures of showing the radiation survey meter, looking for this is a background contaminate, whether there's a background reading. And secondly, this is how you can do a wipe test as well. Okay. Okay. Now I want to move on to the contamination control and highlight that contamination control needs to be checked by means of a survey meter, decon survey meter, where we can see this picture here. This is on the wall. You have a survey meter with a pancake detector with a wire leading to this. And of course, this device is not just operated by battery, but it's also operated by a direct current from the wall. All right. So this supply, so it's 24 hours is working. Right. So when a staff comes out of the a dirty room, they can check their hands, check whether they put their hands without touching the pancake probe, and see whether there's any reading that shows on the screen over here of the survey meter. And if their hands are clean, then they can pick up this survey meter. I'm sorry, it's a bit small, away from the cradle, and they can check their baju, whether their baju is contaminated with radioactivity. And if the baju also clear, then they can also check the base of their shoes, whether the shoe is contaminated or not. So this way, a simple survey meter can be utilized to do the checking. Of course, the alternative of this would be a hand and foot monitor, but the hand and foot monitor, ladies and gentlemen, cost about $60,000 to buy. Whereas if you buy something like this, it can be about $2,000 to $3,000, and it can be you can replicate this or have this kind of simple survey meter at several places around the department so as to help you to do a contamination check. And of course, here at the top, you have an area monitor as per requirements of Papatan, for example. Now, on the middle picture, you see a contents of a decontamination kit. Now, ladies and gentlemen, you see this. This is simple items that most of them you can get in your pharmacy store, or for that matter in your supermarket. Of course, you cannot buy the radioactive waste bag and the label from the supermarket. Other than these two items, all these are items that you can get from your material management department. Macam this one is the usual kitchen green brush that you can buy from Indo's or supermarket. And this is a liquid soap solution. Perhaps it is containing Mama Lemon. That's my famous brand of cleaning liquid soap solution that can be used for doing a decontamination, right? And all of these items are stored in a Tupperware. And this Tupperware, this kind of container has a decontamination written outside. So you can use this for radioactive decontamination, right? So to do and this kind of Tupperware should be kept in many rooms. So when you have a contamination, you have access to this kind of container with all these contents. You can quickly do a decontamination so that the radioactivity does not spread to other rooms. Okay, and so this is again, when you keep it in Tupperware, you can actually keep dust from going inside and affecting the clean room status. So even in a clean room, you can put it in a Tupperware, wipe down the outer side of this Tupperware, and then use this inside the clean room. Next, I want to highlight the next point is warning systems and parameters such as airflow patterns, velocity, etc., which are highlighted in these pictures here. This is the airlock, that is air pressure between clean room and the airlock, QC and the clean room. So these are the things that I mentioned a couple of slides ago, where the pressure in a clean room should be higher than that of the empty room. And now, ladies and gentlemen, you can see the bottom picture here. You see a particle counter and air sampler as well. So air sampler, we discussed this already before. So these are instruments that need to be used in a clean room to determine whether your clean room A and clean room C environments are working according to plan. All right. So for example, some of the particles has to be 0 in a clean area A, whereas in C, it can have slightly higher value. And of course, the hot cell has got a negative pressure of -200 because inside the hot cell is a negative pressure. And of course, not forgetting temperature and humidity, which need to be monitored during your synthesis as well. So these are things that need to be monitored in your clean room during your production. Next, we want to talk about the OSL, TLD, and then we'll talk about surfaces that come in contact with the radiopharmaceutical should not be reactive. So with that, let's move on to EPD, OSLs, etc. need to be worn by staff, and it's very important that the radiochemist wears a finger dosimeter besides the body dose as well. So it doesn't matter whether you use a TLD or OSL, that needs to be provided. And of course, the use of electronic personal dosimeters would be ideal, because this is not real time, but rather this is giving you a real-time reading as well. Okay. And of course, not forgetting, you need to use a quality control, seal sources for your dose calibrator, your MCAs, etc., to ensure that your equipment and instruments are working in a proper order. So this is a picture of, on the left side, you see a synthesis module where this staff with both their hands, sterile gloves and also the overalls, removing a old cassette so that they can insert a new cassette. So the cassettes are basically how all the ingredients are kept in these cassettes. I'm sorry, the hand is blocking the cassette, where all the raw materials for the synthesis can be placed inside there so they can use it for their synthesis. So what I have in front of me, you can see the video, is a sample of a cassette. As you can see, there are many different what do you call it, vials, and they all have got different chemicals inside them. And if you can see on this side, you see also cartridges that are used for purification. So this is an example of a simple cassette. They're color coordinated as well, and they can be utilized for the synthesis of FDG. The synthesis alone will take about 25 minutes or 27 minutes, and that's it. The product is done, and what you have is the final product of F18 FDG, for example. So the input to the cassette would be the fluorine 18 from the cyclotron. All right. So with that, then the chemical reaction, which is controlled by a laptop, is completed, and finally you get the final product, which then goes into the dispensing hot cell. So in the dispensing hot cell, this is outside. The staff is actually looking through this very thick lead glass, and what he is seeing is this. This is what he or she will see. This is the red color is for the cesium source for the dose calibrator, which is the basically this is the dose calibrator here, where you press of a button, this will go down and into the chamber. The chamber is below this opening, right? And this blue portion is nothing more than the air sampler, which I spoke about, where you have to open the blue color to put in the settle plates to do the air sampling of this Class A environment. And of course, this little L-shaped stainless steel is to look after the particle counting, right? And this is the gripper arm that you saw the outside of it. And this is where the vial can be dispensed and sent out of the clean room. And these are needles and filters as well that can be used to do the dispensing from the primary vial into the secondary vial. Okay, so with that, I want to highlight some important differences between a laminar flow and a fume hood. A laminar flow is where a device where the air comes down through a HEPA filter onto whatever you're using. So this is a microscope, but in radiopharmaceutical laboratory, what you would use is the vials and syringe shields, etc. will be in this case. So this is vertical laminar flow. Horizontal laminar flow is generally not utilized in nuclear medicine. This is utilized in other fields such as pathology. But I want to compare this with respect to fume hood. Fume hood basically is when whatever you are using is volatile and it gets sucked out into the environment, away from the environment. So this is when you want to protect the staff who is standing here from the fumes. So this is basically the ducting, right? So with that, I want to highlight to you that a hot cell is on the left-hand side, where you have radioactive items being utilized. And this is an example of a shielded biosafety cabinet. So the labels on the vial should be basically on the vial, stuck onto the vial. And this is a zoom up of the labels. As you can see, the lot number, expiry date, etc., and what is the general contents. But you don't have items such as the activity, the volume, and hence the concentration written on here. Why? Because once you stick this label onto it, this vial is put into the dispensing hot cell, and you don't know the activity yet. So once the activity is put into, after removing the red cap, you put in a certain value, you can write down the value of the activity, the volume, and the time that you dispense it, and on a larger vial label such as this, and stick it onto the container, right, outside of the container. So there's two different, this is once again radiopharmaceutical. So radiopharmaceutical, you're allowed to have the other information stuck outside of that of a vial. Okay, in the vial has simple information only. Okay, so radiopharmaceuticals are intended for use in short time, short half-life, and they have to be transported to do a quality control test before they can be discharged. And we need to have SOP on how to release this radiopharmaceutical, and the responsibility of everyone involved in the synthesis have to be very clearly mentioned as well. And I wish to highlight, this is the QC of radiopharmaceutical. We have a L shield to dispense the QC sample, to do the pH, for example. This is a pH detector, and this is the readout of the pH, and this is the detector sticking into a test tube that contains the radiopharmaceutical. So this is a lead block. This is a top view of it, and the lead blocks basically control the radiation that coming out from the test tube. Okay, so I want to highlight that the GMP requirements have changing have changed since 2003 until 2024, for example. In the early days, it was much more easier for us to comply with GMP requirements. But now, as time goes by, the GMP requirements imposed by PICS and hence our FDA in both our countries have been changing over time as well. And for example, back in 2015, they mandated that air sampling of Class C environment needs to be performed. And 3 years later, in 2018, they said air sampling of Class A environment also needs to be involved. So the ever-changing aspects of GMP, radiation safety has not really changed very much, but we need to comply with both the radiation safety as well as the pharmaceutical requirements imposed by our FDAs in our countries as well. I wish to summarize and say that GMP is significant for radiopharmaceutical production. There's no running away from this, and there are specific guidelines from applicable GMP regulations that are unique to radiopharmaceuticals need to be complied. And GMP guidance represents control of multiple aspects of the manufacture, and adherence to GMP guidelines for product manufacture is a requirement that we need to meet as well, and ever-changing requirements by auditors at the PIC, which I showed you in the last slide as well. And the production and release of radiopharmaceutical for patient use poses considerable challenges for a facility because they need to comply with both radiation as well as aseptic nature, right? So as I mentioned, both aseptic practices to ensure sterility and the quality of a radiopharmaceutical and staff radiation safety needs to be complied. Sometimes they are opposing to each other, but we need to find a good, amicable solution so that we can both look after radiation safety for staff as well as looking after the clean radiopharmaceuticals that we synthesize. So there's a need to reconcile both radiation and pharmacological regulations and a risk assessment based on aseptic and radiation safety aspects. So important take-home message here is that you need to be conversant not just on aseptic process, but also radiation safety. So for example, if it's a pharmacist from your hospital, he or she needs to learn about radiation safety as well. For example, on the other hand, if you have a physicist working in a hospital, they are familiar with the radiation safety of unsealed sources, they need to know about the aseptic effect. So it's a cross-learning that is needed. So the final product can be both radiation safe for the staff manufacturing it, as well as it has got a very good aseptic practices. And these are my references and useful publications that we have. And I want to show you some pictures of what the Indonesian institutional visitors to my hospital last year from the FDA, from the Bapatan as well, who have come by and look at our facility, which has got GMP compliance since 2003. We are making PET radiopharmaceutical for use in patients as well. So with that, I want to highlight what I saw yesterday. I went to IKN and I also looked at your beautiful buildings at IKN, and that's me. All right, and this was a photograph taken at last week at Samarinda during a workshop. Okay, so I think this is my last slide. Yeah, that's right. Yeah. And if you come to Singapore, please eat chili crabs. We are not very far from Indonesia. I think our closest neighboring is Batam. I think we can reach Batam in 1 hour from Singapore. Okay. So with that, I wish to I say that I've completed the lecture, but you please ask me questions. Thank you.
Okay, thank you so much, Mr. Somanesans, for that incredibly informative and enlightening presentation. The material you delivered truly brought us our insight into the importance of integrating radiation safety and aseptic procedure, especially in the GMP of the production of the radiopharmaceutical. Okay, maybe for all the audience that we have in this meeting and in the classroom, maybe for the student, anyone have a question, you would ask to Mr. Somanesans, you can raise your hands maybe, or maybe in the Zoom meeting, you can using the feature of the raise hand.
I've also put my email address. If you can't come across a question now, or if you think about another question, you can always email me, and I'm more than happy to answer your question.
Thank you very much. You're very kind. Maybe along with we waiting the question from the other audience, I will ask some question about the difference between this production of radiopharmaceutical that we use in a generally using a cyclotron and the difference between this GMP. So can you describe in as simply for the difference between the cyclotron and the GMP? What the difference? Is it we still use the cyclotron and we use the different way to moving it out into the hot cell and anything, or like what?
Okay, so I think your question is, let me go to the slide. It's merely a picture actually, which is yes, over here, right? So this slide here, generally the PICS or GMP auditors in Ministry of Health of Indonesia won't be looking at this part. All right, they won't be looking at the left-hand side, but they will focus all their attention on the right-hand side, and that is the GMP portion of it. Whereas Papatan will look after the left-hand side. The left-hand side is the non-GMP component, which is the irradiating equipment, such as the reactor, for that matter, or it could be the cyclotron that is used for the synthesis of the fluorine-18 or carbon-11. So this portion is Papatan's responsibility, whereas on the right-hand side would be the FDA of the Ministry of Health responsibility to look after this portion. So the regulations are on either side. This one is for the radiation license, and this is for the aseptic manufacture of pharmaceuticals. Is that okay?
Okay, I have a few following question about this one, about the production maybe. So the production, as we know, that the cyclotron in generally product FGD of fluorodeoglucose 18, and it's cannot product like iodium 131 or maybe technetium 959. And the GMP we can product that.
Yeah. Yeah, well, see, put it this way. If you have the cyclotron, generally, okay, 90% of the cyclotrons out there, even I would say 100% of the cyclotrons in Indonesia currently can make PET radiopharmaceuticals, such as fluorine-18, carbon-11, maybe gallium-68, all right? So they cannot make technetium, for example, or they cannot make iodine, for example, or other kinds of long-lived nuclides. But theoretically, if you buy a large cyclotron like 100 MeV or 30 MeV, then you can make things like iodine 124, iodine 123, items such as this, all right? Or for that matter, other kinds of radionuclides as well. So once again, irregardless of what they are able, the characteristics of the cyclotron, be it the energy, etc., they're considered as a non-GMP component of it. That means the mechanical aspects of the cyclotron, the vacuum aspects of the cyclotron are not under the jurisdiction of the FDA or the GMP, but they come under the regulations of the Papatan, for example. Right. So once that is synthesized, it is sent directly into the hot cell, which continues with this aspect of it. So generally, when I've been audited by GMP auditors since every year since 2003, that makes it about 22 years. They have come to my facility. They will start off from here. Say, how does a fluorine enter the hot cell? Does it go to any other place, etc.? That's the first question. And the second is they say, how do you receive this fluorine 18 onto the module? And then I have to explain to them and thereafter. So the documentation, the validation, etc., all that is from this step onwards after the fluorine arrives into the hot cell.
Okay, thank you very much for that
Okay.
very crystal clear answer. Maybe for the other audience or maybe student. Ya, mungkin kalau ada yang mau nanya dalam bahasa Indonesia, nanti saya akan bantu terjemahkan.
My apology, my bahasa is not very good, so I may not be able to answer in Indonesian, but please, you can interpret for me.
Yes, it's okay, Mr. Tomanisan. Don't worry.
Saya boleh cakap sikit-sikit. I just go through the slide so that if you have a question, you can ask me. While we wait for the question, Kenny, please allow me to explain that these are hot cells where you received your PET radiopharmaceuticals from under the ground. Under the ground, they have a tubing that enters these synthesis modules, and therefore they are in a very clean environment and a closed system. Whereas if you look at the right-hand side picture, is a shielded biosafety cabinet that is typical of technetium handling, where you have a generator that you milk the generator or elute the generator and use it for the synthesis. Right here, the air can come from the outside inside as well, but here you cannot. There's a strict adherence. So this is GMP and this is non-GMP.
Okay, thank you so much, Mr. Somanisan. Actually, we in the class already have one question from Mrs. Herwin.
Yes.
Yes,
Please welcome.
Okay, good afternoon. Can you hear my voice?
Yes.
All right. I have one question for you. Regarding the pressure in the room, there is one slide that shows different pressures in different areas. What is actually the purpose of having this different air pressure?
Very good question. Thank you very much for this question. The difference in pressures is a requirement for the clean air, basically. If you look at this picture here, the clean room is on the left-hand side. It's called RC's radiochemistry. Yeah, this is a positive pressure. So the air that enters this room is through HEPA filter, this small little blue squares with red arrow coming out. This is called a HEPA filter, right? There's one here, and another one here. So the air that enters this room is coming through a HEPA filter which stops 0.2 micron particles, right? Macam dust is also stopped. So the only way fresh air come inside here is through these filters, right? So these filters will stop all the large dust particles and also the bacteria from entering the clean room. So macam this is similar to operating theater, where the air in the operating theater where the operation is going on is also coming into the operating theater through a HEPA filter. All right. So this is a positive pressure so that the air from outside does not enter. Macam even if you open this door here, since this is a positive pressure compared to here, this dirty air is not going to enter the room. Whereas if you open this door, for example, the air can go out. that's fine because it's a clean air can come out into the unclassified quality control room, for example. But you cannot allow the vice versa. You cannot allow the air from the QC room to enter into the clean room this way. The only air must come through HEPA filter.
Thank you.
Herwin,
Thank you.
thank you for the question, Herwin.
Yeah.
Thank you, Mr. Somanesan. Maybe we still have a time for another one question. Any other?
Okay, thank you, Mr. Soma.
Yeah.
In here, there are 80 students,
Ah,
50 undergraduate, and
uh,
36 profession of medical physics at Diponegoro University.
mm,
What your recommendation? Where is visit to GMP cyclotron in Indonesia?
ah.
Where is
Uh,
recommendation, please?
Okay, I don't have a recommendation, but I know Dharmais Hospital has, it really depends where your university is located, whether you have a GMP facility in your province, I'm not sure. But in Jakarta, we have, I think there's Dharmais Hospital. Has a facility that has GMP, and there are private facilities as well around Jakarta, by name of Kelbe and Cardinal Health or something like this. They also have GMP based production being set up. There is a hospital, old hospitals facility in Gading Pulit in Jakarta as well, which has been having GMP-based radiopharmaceutical production for some time. I'm sorry, I don't know other facilities. Perhaps you can inquire from BRIN, whether there are any facilities. Offhand, I can help you to link you up with other facilities. Professor Zainal?
Okay, thank you. I have my student can change student mobility to Singapore hospital.
I think that's possible. You can visit us as well to look at our facility.
Okay, thank you. Any question, Mr. Kenny?
Okay, maybe for me it's enough, and for other student and the participant in this meeting, it's already clear about your lecturer, talking about GMP, the safety radiation in the production of radiopharmaceutical and anything else. Um, like Mr. Zainal said, this is I'm here with the student of undergraduate degree and the medical physics profession. I am also one of the medical physics profession. Maybe you can accept me later if we go into the Singapore. Yes, Mister. Is it okay?
Certainly not
Yes.
not everybody in the same time, but one by one, boleh.
Okay. We talking about the cost also. If we go
Yeah.
into the Singapore in the whole team going there,
Yes.
it's very expensive, I think.
Yes, and I think we can write to Dr. Zainal and see whether we can find a nearby place for you to visit as well. Maybe certainly in Samarinda there is one facility as well.
Okay, yeah, I was very curious about the facility in the Singapore. Like as we know that, and the other thing, other on the nuclear medicine like radiotherapy. You guys already have a proton beam and anything else
Yeah.
that we in Indonesia not already use or have it
Yeah.
like that. We want to learn about it. We
Visit.
want to see about it.
Sure. It's
And
nothing like seeing and touching the instrument when you see the science come alive.
okay, maybe we are going to there, but I don't know when. Thank you. Thank you
Thank
very
you.
much, Mr.
Okay.
Somanesans. I would like to extend my deepest gratitude to Mr. Somaneson for this valuable knowledge and insight. We hope this material will be a useful resource for
Sure.
all of us, especially for physics student, medical physics profession, and anything other else. Maybe you have any closing statement or motivation for us?
Nothing, all the best, and
Yes, sir.
we should dream for more access to pet radiopharmaceuticals in the country.
Okay, thank you so much. Maybe I would like to read the conclusion that I made in
Okay.
your lecture that
Okay.
you have said about the safety consideration, the activity of radionuclides. It's a very important thing about us to in the production in the radiopharmaceutical. So we have to know about the basic element in the GMP like QA, QMS, and any other else that we know that GMP is minimize the rise of microbial, so it's more sterilized and we can produce the best or maybe for now the better radiopharmaceutical to give a safety consideration for other patient and give the best service to patient for them.
Yeah.
Okay, thank you so much. I would like to thank all the community member and the participants who attend the actively participate, especially for you, Mr. Somaneson, to join this meeting, give a lecture, and welcome us later in the Singapore. Please accept my apologies for any shortcomings on my part of the moderation. See you in the next event. Have a wonderful day, and maybe I will give back to the master of the ceremony. Thank you.
Okay. Thank you. Thank you for the nice summary, and thank you, Dr. Zainal, for that question.
Once again, thank you very much to everyone for your active participation. We hope today's lecture has been fruitful and beneficial for all of us. Stay safe, stay healthy, and we look forward to seeing you again in our next events.
Thank you. Bye.
Before we officially close, we would like to kindly ask all participants to please turn on your camera as we will have a document session. Let's take a group photo together to capture this memorable event. Please take a group photo together to capture this.
Please stay on your screen and smile for the camera. We will count down.
Okay. Turn on your camera. Okay. We will count down. 3, 2, 1. Smile. Okay. Thank you very much.
Thank you.
Okay. Thank you very much to everyone for your active participation. We hope today's lecture has been fruitful and beneficial for all of us.
Please give applause.
Please give applause.
Thank you. Thank you.
Thank you, Mr. Soma.
Thank you. Bye.
Thank you.
Bye.
Bye.
Good luck.
Okay, thank you.